Welcome back to What's Up, Doc, a podcast by Miramont Wellness Centers in Fort Collins, Colorado, hosted by Dr. John L. Bender, MD, and CEO of Miramont Wellness Centers. Our mission is to empower your community and yourself to achieve healthcare and wellness aspirations anywhere in life.
Welcome back. It's time for another exciting episode of What's Up, Doc. I'm your host, Dr. John Bender.
And I'm Jeanette Visconti.
Thank you so much for joining us once again from Toledo. Well, today's episode, we're going to be discussing a sensitive topic. And this happened once where I had a patient come in and they were considering compound semaglutide, but one of the reasons that was holding them back is they were really concerned about how they would look deflated after they lost their weight in having this loose skin. On social media, it's sometimes referred to as Ozempic face, and yet the reality is that most people do okay with weight loss. They do get some skin tightening, but when we start losing weight later in life, or if there have already been a lot of stretch marks, let's say, from childbirth, or if a person has a lot of weight to lose, maybe they're going from a BMI of 40 down to 30, loose skin can become an issue. So one of the things that we've had to do here at Miramont, Janessa, is innovate in skin tightening. Isn't that right?
Yes.
So the first technology that we brought on board was called the Transform Evolve, and this is a simple external technology that uses heat energy to tighten skin, and it gives some pretty good results. Typically, people will go through a weekly or twice weekly session for 6 to 12 weeks, and we can add in some muscle toning as well. The benefit is it's not as expensive. Typically, this is about a $1,200 treatment, and results are reasonable. Not going to give earth-shattering results, but something that can be appreciated. We then decided that we had to do something more. And so about the time that the COVID pandemic lockdowns were occurring and we were not as busy for a period of time, we were very busy when there were pandemics raging through the community, but in between pandemics, it was kind of slow. You and I started getting some skills in the surgical arena. Isn't that right?
It's very true.
Yes, and so I have some fond memories of Janessa in those early days of our FaceTite and BodyTite program. So what is FaceTite? What is BodyTite? Well, let me contrast it with the traditional methods for dealing with skin tightening. So since the 1950s and 60s, plastic surgeons have known that if they make two big incisions here, they can stretch the face, cut off the extra skin. Those surgical procedures can take weeks to recover from before you look like yourself again. So with FaceTite, basically here at Miramont, we offer a minimally invasive surgical procedure. It is a surgical procedure, but I make two little incisions here and here right in front of the ear that you'll never find 6 months later. And when everyone tucks their chin, there's a little crease here. We hide one of them, we tuck it in that crease. We do use tumescent, which is where we add a little bit of fluid under the skin that's got some numbing medicine and things to help with blood clotting. And then we add heat energy. Now, the heat energy is interesting. Basically, this technology is made by InMode. And at the very tip of this probe, we are cycling the temperature at 1,000 to 2,000 times per second. And so at 72 degrees Celsius, which is really hot, we would produce a burn. But at 70 degrees, just slightly less, we receive a perfect contraction of up to 47% of what's called the fibroseptal network. And that's going to tighten that skin over a period of 6 to 12 months. We do perform liposuction at the same time. So if there's a little bit of extra fat in the turkey neck area or in the jowls or in the lower face, we're going to clean that up. But the skin tightening allows us to get away with making those tiny incisions. Occasionally we'll have to do a thread afterwards, not too often, maybe 1 in 25 cases. But most people are going to have an outstanding result with lasting jawline definition. We've performed these on people in their early 30s up until age 82. Best results are probably age 72 and below for that technique. We can also tighten around the eyelids, and we have that with the AccuTite. And then finally, we offer BodyTite. So we've had individuals that have lost 50 pounds, and their before and after pictures, they look outstanding, but then the person wanted a little bit more. So now that after picture becomes the before picture, and you can now see that there is quite a bit more tightening that has occurred. Well, how do we achieve that? Well, with this instrument right here. So this is the BodyTite, much like the FaceTite, a little smaller. Again, we're making tiny little incisions, 2 just below the bikini line, 1 in the umbilicus or belly button. And then I'm going through and literally ironing every square centimeter of the skin. We do these under some light sedation, oftentimes using nitrous oxide, mixture of oxygen if necessary, some sublingual medicines that help with pain and anxiety. There's usually a room full of people. There's about 4 to 6 people in the room for these procedures. I have a surgical assist, we have a circulator, we have a scribe, we have someone running the machine, an esthetician, who then performs some microneedling at the very end of the procedure to help with the really light crepiness. And we can remove a couple liters of extra fat tissue, that stubborn belly fat that sometimes the last 10 pounds or 20 pounds is very difficult to get rid of, even with the compound semaglutide, even with hormone balancing. And so when people have semaglutide and they lose their weight, and we balance their hormones with Biote, the bioidentical hormones, which we've spoken about in other podcasts, and then we now add in the skin tightening magic of the in-mode FaceTite and BodyTite, we call it the Trifecta, because we now have helped people get to that goal of having a nice toned body with skin that they can be proud of and at a healthy weight where they are metabolically cured, no longer pre-diabetic or experiencing fatty liver or problems with their blood sugars. And we're very proud of this program that we've built. And Janessa, any other thoughts on skin tightening?
No, I've seen a ton of great results, and overall, this procedure is tolerated very, very well. It's something that we're very, very proud of here at Miramont because comparable, if you go to a plastic surgeon and you get a mommy makeover, it's going to be a heck of a lot more expensive than what we would ever charge here at Miramont for a procedure to get some of the same results.
And it's going to be a quite larger scar. I mean, typically that's a large, what they call fawn and steel type incision down along the bikini line as opposed to those 2 little dots. Well, we've reached our time once again. Janessa, I want to thank you for being here. On behalf of the What's Up Doc crew, I'm Dr. John Bender.
And I'm Janessa Visconti.
And we will catch you next time. Take care.